All right, thanks, Rich. Well, according to the National Stroke Association, stroke is the #3 cause of death in the U.S., and it's the #1 cause of adult disability. But there are ways to reduce your risk. First News contributor Dr. Michael Sevilla joins us now with more. We talk about the warning signs, numbness and the speech, slurring of the speech, and so on. It's hard for people to know, though, because there are other things, like even a migraine can feign the symptoms sometimes. When you have a migraine, you get the numbness, you can't talk correctly. How do you know? And how much time do you take figuring it out?
Sometimes you don't know, but we do know that if we do catch a stroke early enough, like within the first few hours of people recognizing when their symptoms are, there are some steps we can take, there are some treatments we can do, we can even reverse the symptoms of a stroke. So if people start to have those type of symptoms, even if it's very subtle, it could be the first signs of a stroke.
Do you pay attention to the duration? Like, say you're a little numb and give it so much time, a half hour, and it's not coming back. Then you make a phone call, you call what's your first steps? Do you call the doctor?
That would be my first step. Especially, there's a lot of people, especially older people, that live alone, and they think it's going to go away, or it does go away. But it could be the first sign of something more serious, like a stroke. And it doesn't have to be very severe. It could just be very subtle. And a lot of people say, oh, I had numbness about two hours ago, and it went away. But then 2 hours later, they had very severe symptoms. So recognizing it early is key.
And get something done about it. Now, what about trying to prevent it from happening, basically? What are some of the steps that you can take?
Well, we know the high risk factor groups are people with high blood pressure that's not treated at all or not adequately treated. What we aim for is a blood pressure between 120/80, and that not only decreases your risk of stroke, but also for heart attacks, heart disease. If people have sugar diabetes or have cholesterol problems, those are also risk factors. So get those numbers to where your doctor says the goal is.
Right. Nowadays, it seems that so many people do get checkups. They know what their blood pressure is and so on. Are there still a lot of people out there who don't keep tabs and just think, well, I've always had low blood pressure, I don't have to worry about it? But things that can change. You can switch, is that correct?
Yeah, I mean, you can have any kind of change at all. I mean, that's why stroke is kind of the #1 cause of disability in the United States, because people go along and say, oh, my blood pressure has always been fine, oh, I've never had symptoms like headache and things like that, and then they have a severe event like a heart attack or a stroke, and it just definitely disrupts their life. So regular checkups with your doctor are recommended.
Right. So a yearly checkup? By about age what? By 40?
Yeah. Unless you have a risk, you have a risk factors. You have a family history of medical problems like stroke or heart disease or diabetes. Definitely should get checked sooner, because we do know there's a genetic component to all of these.
Very good. Very good. Well, thanks. Lots of good tips this morning, Doctor. It was nice to see you again this morning.